Hello, everyone. This is Andrew Saul, and this is That Vitamin Summit 2. More information because people asked for it. And we have with us today one of the physicians that really has done a lot with high-dose vitamin C therapy. It's Dr. Victor cial-Vega. He's with us today from Puerto Rico, the Puerto Rican Health Sciences University, where they're doing wonderful things with vitamin C in high doses, intravenous vitamin C against cancer. Dr. cial-Vega is a radiation oncologist. So if someone tells you that this vitamin C stuff is unproven and real doctors don't do it, you can tell them that they have made an error, because Dr. cial-Vega is a very well qualified physician. And I want to welcome you, Dr. cial-Vega, today. Thanks for being with us.
Thank you, Andrew. A pleasure.
Let's get right to it. How do you treat cancer with vitamin C?
Well, we have found through a report that is called the President's Cancer Panel Report. I would like everybody to see this because it's probably one of the most important documents that has been produced by the U.S. government. It was written by the National Cancer Institute, National Institutes of Health, and the Department of Health and Human Services. So those are the authorities in the United States. It's not only Dr. cial-Vega saying it. They are saying that the cause of cancer is environmental pollution. Pollution of the water, pollution of the air, pollution of the food chain. They even put it in a picture for President Obama, who commissioned this study. And here is the pollution. You don't see genetics there as a cause of cancer, like most oncologists will tell their patients. That is just not true. So by removing these toxins from the body and giving the body what it needs to regenerate itself from the damage done by these toxins, which, by the way, rob the body of electrons, and that's the chemical pathway to disease, we can theoretically reverse a cancer. And that's what we have been seeing in the last 25 years. One of the best electron donors and removers of these toxins, among other antioxidants, is vitamin C. So I've been using vitamin C orally and intravenously for more than 20 years and seeing great results as part of a complete program of nutrition, stress reduction, exercise, and detoxification. Mm-hmm. So that's how we manage cancer. At the very least, anybody that chooses to do chemotherapy, radiation, surgery for cancer must do a detoxification regeneration program anywhere from 2 to 8 weeks before those conventional treatments. That is a must. I consider that so necessary and so useful that I consider it malpractice if it's not done. Now, most oncologists will not agree with me, and the reason being is that we're not educated properly in medical school and the academic institutions. I've been a professor in 3 universities: Washington University in St. Louis, University of Miami, and now in the Universidad Central del Caribe School of Medicine in Puerto Rico, and none of them are educating physicians or students properly as to the use of nutrition. They are not training physicians as to what toxicity means, a course in toxicity and detoxification. So, of course, we're not being trained properly. We're being trained to use drugs, medicines, procedures, radiation, surgery, and so forth. And that has been the focus in oncology. Once we do that 2 to 8 week program of detoxification, regeneration, nutrition, we see more than half of the patients will have a decrease of their tumor size. Sometimes it will disappear, but it will definitely, at the very least, prepare them for a successful or a higher chance of success with chemotherapy, radiation, and surgery. There are already randomized studies that show that patients that undergo intravenous vitamin C before surgery have less complications, less pain, less bleeding, almost no bleeding during the surgery, which is the main problem that the surgeon encounters during the surgery, is bleeding, and they can only assess it by clamping arteries and veins or burning them. by using intravenous vitamin C, there's practically no bleeding. So that helps the surgeon as well and decreases the chances of complications, like I said, and also the patients leave the hospital much earlier and with better healing of the wounds. Mm-hmm. There are also randomized studies that show that the use of vitamin C, and this has been in South Korea as well as Japan, there are randomized studies. There are retrospective studies, but there are also randomized studies that show that the use of intravenous vitamin C, definitely without a shadow of a doubt in these studies, decreases the chances of complications, increases the well-being of the patient in all the systems that are studied: cognitive, endocrine, cardiovascular, neurological, musculoskeletal, gastrointestinal, and so forth and so on. And that's what we want. We want people to feel well. We tend to send our patients in oncology, this is how we were trained, we tend to send them to chemotherapy with no preparation whatsoever, and that doesn't make any sense. So vitamin C has been a tremendous tool.
Now, everyone is thinking right now, vitamin C chemotherapy. I read, I heard, a doctor told me, I saw it in an article, it was on TV, that vitamin C interferes with chemotherapy. What's the story here?
Unfortunately, that has been the teaching in oncology schools. I was trained at the Johns Hopkins Radiation Oncology Center. I'm a radiation oncologist, board certified. And my professors, including Stanley Order, DJ Lee, Moody Warren, which are tremendous professors of radiation oncology, they all came to the conclusion in the 50s, 60s, and 70s that any antioxidant could theoretically prevent radiation from working, as well as chemotherapy, because chemotherapy and radiation are produce free radicals and are in themselves not only free radicals, but they also can cause cancer, radiation and chemotherapy. So they say, well, if the effect of radiation and chemotherapy is to produce free radicals, and we use antioxidants that neutralize free radicals, we may theoretically prevent radiation and chemotherapy from working. And that made perfect sense from the radiobiological and chemobiological point of view. It made sense, but there were no studies whatsoever about this. It made so much sense that we all agreed and concluded that that was a fact. But there was absolutely no data and no information about it. And I was trained that way, and we were all trained that way. So it's very hard, and this is what happened to me initially, to agree with a patient that wants to take antioxidants. When I started my radiation oncology practice, I would say, no way, you cannot do that. You will neutralize the radiation. Until a patient of mine said to me, I don't care what you said, doctor, I'm going to take them. So they took him, and a patient with ovarian cancer before starting radiation and chemotherapy, and I documented this case in 1991 in the Baptist Hospital of Miami, started taking vitamin C, started taking antioxidants, started taking what we call ACAT, and the ovarian cancer markers went from 1,400, the CA-125, to 800 in a week and a half. Then it went down into 3 weeks to 400. Then it went down to 100. This was before starting therapy, and I was surprised. During therapy, it kept coming down. And now all my ideas and preconceived notions about antioxidants and chemotherapy or radiation came crumbling down with this patient. And that's how I started researching this matter. And to make a very long story short, because now is 2017, we've done studies also in our clinic, which we're about to publish, that confirm that the use of vitamin C in patients that are doing chemotherapy seems to increase the response rate and decrease the complication rate. I say seem because it's not a randomized study, but it does confirm that it actually increases the effect of the radiation and the chemotherapy. So, but to get this idea out of the mind of oncologists, I totally understand them. I went through it. And it's going to be very hard, but the younger generation understands this, and they're more open to the idea.
Very good. Let's talk dose. How much vitamin C?
First, we start patients orally. We start them in a dose of approximately 12,000 milligrams a day.
Orally.
And we may increase that to 15 to 20,000 a day, depending on their tolerability. And then I like to start supplements for about 2 weeks. I do the pH of the saliva and show them how they can start getting more alkaline versus acid. By the way, toxins in the body rob the body of electrons. So they start promoting acidity in the body, which is a loss or a lack of electrons. So we can measure electricity in the body indirectly by measuring pH. The saliva should always be alkaline to maintain the integrity of the gums and the teeth. Calcium phosphate gets in the teeth and becomes solid by alkalinity. It dissolves and becomes ionized or atoms that dissolve by acidity. So that area gives me an indirect indication of how the pH is in the body. So by measuring that in those 2 weeks, the patients start learning about how they can monitor themselves. It's very important that nobody takes vitamin C in my clinic without monitoring. So I ask them to do a pH 3 times a day, before meals, always before anything goes in the mouth, never after brushing their teeth, chewing gum, or drinking water. So before a meal, let's say before lunch, your pH is alkaline. That gives you a pretty good idea that what you had for breakfast was good for you. If what you had for breakfast was not a good meal in terms of robbing your electrons or not giving good antioxidants to you, your pH before lunch will be acid. And that's a rule of thumb. It's not 100%, but it gives a good idea to the patients how to monitor themselves. Then 2 weeks later, we start intravenous vitamin C. We start with 20,000 milligrams, which is 20 grams intravenously. And weekly, we will increase it up to 60,000 milligrams intravenously. Even though we do it once a week, we like to do it every day if possible. Sometimes that is not feasible for many reasons. But at least we try to do it once a week.
What would be ideal?
Ideally, it will be every day, because we can rapidly remove those toxins and regenerate the body. But sometimes because of cost, because of where the patient lives, that is not possible. But in my opinion, it will be every day. And if we could do it 24 hours a day, which is our goal, to have a facility which will be a center where patients can come in and have it and stay inpatient and have it 24 hours a day, I hypothesize that that will be the way to go, 24 hours a day.
What about for people who can't find a doctor that's willing to administer intravenous vitamin C? How can they make this happen in their own home, their own hospital, with their own doctor, where they are?
Fortunately, there are many physicians today that are very open to the idea, because they see it as a vitamin IV, and there's accepted vitamin administration in hospitals today. But of course, it's a preformed form of concoction of vitamins, including vitamin C, B1, B6, and it has, unfortunately, aluminum as a preservative. We don't like that. But already there are preparations in every hospital in the United States that use vitamins. So I tell the patients and the doctors, listen, this is not so far away from what we're already doing. The amount, it is far away, because they use 500 to 1,500 milligrams. We're using—
That's the issue.
That is the issue. But if patients look into Google, more likely than not, they will find practitioners that use intravenous vitamin C. And there are many institutions like ACAM that train physicians, and they can find a physician that's ACAM certified. but there are more and more in each state every time. So look in the internet for intravenous vitamin C, intravenous chelation therapy, intravenous nutritional therapies, and more than likely you'll find a practitioner close to you.
Mhm. So it's essential to have a practitioner right there, right on hand, right online, rather than try to convince a doctor who doesn't want to do it that he should or she would. It's better to go right to a doctor who already says yes and work and bring them into the case. Would that be correct?
Absolutely. I will definitely recommend a medical doctor that has experience in the matter. And that is the best bet. Fortunately, we have thousands of those in the United States today. So patients shouldn't have a major problem finding a practitioner that will assist them in this matter.
Mhm. Have you personally run into opposition for using intravenous vitamin C?
Every day for the last 25 years.
You seem very mellow about it.
Yeah, because, you know, I understand the other side of the coin. I've been there. And physicians are just ignorant. It's not because we want to be ignorant. We've been purposely misinformed and miseducated in medical schools. It's a major scheme. Pharmaceutical companies are the owners of medical school, and they're watching out for their interests. It's as simple as that. So when we start finding these other modalities, they're so far away from our curriculum that doctors think that you are doing something way out of what medicine should be doing, which is, but in reality, it's quite the opposite. This is what medicine should be doing, promoting the health of the body, promoting nutrition. We're not training nutrition in medical school, period. We have no idea how to use nutrition. We have no idea what toxicity means. The concept of a course in toxicity, environmental pollutants, how to remove them, and the implications in the human body is just not taught in medical school. 25, 30 years ago, when I went to medical school, 31 years ago, stress was not an important component in health, period. That was the conclusion. That's crazy, but that's what I was taught in the best institutions in the world. So things that are for free, like exercise and stress reduction, are definitely not promoted in our present system. But we're coming around again. We have to do it because the system is collapsing. Medicare, Medicaid, healthcare system is truly collapsing around the United States and Puerto Rico because the message is clear. We cannot keep continuing managing chronic diseases with bypass surgery and transplants and dialysis and medication. We have to go to the cause of the problem, remove the toxins, and the disease will reverse. In most of these chronic diseases like Alzheimer's, autism, arthritis, high blood pressure, diabetes, and so forth and so on, cataracts, allergies, asthma. The list goes on and on. So it's a bright future for what we're doing. So I'm very excited.
Are there any cautions that typically come up, say people that have impaired kidney function or people at risk for iron overload or they have a genetic condition? What screening do you recommend that doctors do to make sure there's not going to be a problem with IVC, or are there no problems?
Although I've been trained to do G6PD dehydrogenase analysis in every patient that undergoes intravenous vitamin C, that hasn't helped me at all. Because some patients that have been deficient in G6PD deficiency, as long as we go slowly, we can help them with the deficiency. So the key to all of this is to go slow. If we go slow, even patients that have the complete mutation or the partial mutation of the G6PD deficiency will be helped by intravenous vitamin C. Number two, I was also taught that kidney stones were promoted by intravenous vitamin C at high doses. I have never seen that. I have given intravenous vitamin C to patients that have kidney stones or have a propensity for kidney stones, and that helps them get rid of the kidney stone. I haven't seen intravenous vitamin C promoting, excuse me, kidney stones. The main precaution, this one is a real one, that should be always addressed, is hypoglycemia. During intravenous vitamin C, the metabolism is stimulated, and also it may promote the release of insulin, and other things may happen that may lower the glucose in the blood, which is a good thing. That's not a bad thing. But we tell all patients, and this is as a rule, because this is a side effect that we used to see years ago. We tell them they have to eat before the IV, and they have to bring snacks. As long as they do that, this side effect will not occur. So if we can prevent that side effect, we pretty much don't have to worry about much else, except if the creatinine is very high, if they have chronic renal failure that is severe, we have to go slow and be very careful of the amounts of vitamin C. But vitamin C can help them, because United States studies have shown that every single patient with chronic renal failure that has had biopsies of the kidney has been found to have heavy metals like lead in the kidney, causing the clogging up and the chronic renal failure. So the leaded gasoline that was used in the 50s and 60s is still around in the ground, that lead. And a lot of the mercury and a lot of the arsenic and cadmium and other heavy metals that we know are out there are causing the major epidemic of renal failure in the United States. There are randomized studies that have shown that this can be removed with vitamin C or chelation and reverse the process.
Now, you just said randomized studies have shown that vitamin C can remove cadmium, mercury, lead from the human body.
Not randomized studies, regular studies.
Regular studies, observational studies.
Yes. There have been randomized studies of vitamin C for kidney disease and randomized studies of chelation therapy with kidney disease, and randomized studies of heart disease with heart disease with chelation therapy.
Okay.
Vitamin C has only been studied in a randomized study for cancer patients on chemotherapy in South Korea, and the results have been very positive.
Very positive. So vitamin C, again, by being an antitoxin, has so many ways of helping a cancer patient get better. It's just astonishing, isn't it?
It is astonishing. I wouldn't even call it a vitamin. I think calling it a vitamin is an incomplete definition of vitamin C. Vitamin C is an electron donor. It's almost like a hormone sometimes. It's a neutralizer of toxins. So it's an antitoxin. It's also a tremendous antiviral. We recently wrote a paper of 56 patients treated in Puerto Rico for chikungunya with intravenous vitamin C, with most of them having a relief during the IV. So we confirmed what the literature has shown, that vitamin C has cured polio in the past, including meningoencephalitis and flaccid paralysis by polio, by Dr. Klengart, and shown already. I mean, that is an antiviral effect against hepatitis A, B, and C, herpes 1 and 2, and we've seen it in the clinic, Epstein-Barr virus, rubella, dengue fever, Zika virus. We've seen the Zika virus is extremely sensitive to vitamin C. So with all these properties, vitamin C is a multifaceted agent besides being a vitamin. So just saying it's a vitamin is not giving it due justice.
Well, we thank Dr. Frederick Robert Klenner and Dr. Robert Cathcart and Dr. Hugh Reardon. And we thank you, Dr. Cial-Vega, for being with us today. This was just been a wonderful opportunity to hear from a physician who's actually doing it. The old saying is, the person who says it can't be done should not interrupt the person who's actually doing it.
It's such a simple thing. It's amazing. It's one of the, unfortunately, biggest secrets in medicine today. And it's because of ignorance. Once you start doing vitamin C once, you never go back. It's amazing.
Well, thank you for sharing.
Oh, thank you. And I would like to also give credit to our pioneers these days, like Ron Honingate and Tom Levine. I mean, these are our new pioneers in intravenous vitamin C around the world.
Well, they're wonderful physicians, and we appreciate your work too. I feel better just listening to you.
Oh, great. Tom Levy, I should say. I said Tom Levine is Tom Levy. But I'm glad that you feel better. I do as well, because, by the way, I do my intravenous vitamin C as well, and chelation therapy and other things. I would like to ask physicians to do it for themselves, because it will change their lives. It truly is an amazing tool in our clinic.
So here is something that offers real hope to people. Find that doctor who will actually do this. There are doctors that already are. We need to make a point to see that this happens. We cannot wait for our family doctor or our oncologist or the hospital to offer vitamin C therapy.
Correct. I agree with that statement. Is perfect.
Well, again, thank you very much for being with us.
My pleasure. You're welcome.
This is Andrew Saul for That Vitamin Summit 2, and we've been interviewing Dr. Victor Marcial-Vega in Puerto Rico. Thank you, doctor.
You're welcome. Take care. Thank you.
Vitamin C against cancer. Dr. Marcial-Vega is a radiation oncologist. So if someone tells you that this vitamin C stuff is unproven and real doctors don't do it, you can tell them that they have made an error, because Dr. Marcial-Vega is a very well qualified physician. And I want to welcome you, Dr. Marcial-Vega, today. Thanks for being with us.
Thank you, Andrew. A pleasure.
Let's get right to it. How do you treat cancer with vitamin C?
Well, we have found through a report that is called the President's Cancer Panel Report. I would like everybody to see this, because it's probably one of the most important documents.
Hello, everyone. This is Andrew Saul, and this is That Vitamin Summit 2. More information because people asked for it, and we have with us today one of the physicians that really has done a lot with high-dose vitamin C therapy. It's Dr. Victor Marcial-Vega. He's with us today from Puerto Rico, the Puerto Rican Health Sciences University, where they're doing wonderful things with vitamin C in high doses, intravenous vitamins.
That has been produced by the U.S. government. It was written by the National Cancer Institute, National Institutes of Health, and the Department of Health and Human Services. So those are the authorities in the United States. It's not only Dr. Marcial-Vega saying it. They are saying that the cause of cancer is environmental pollution. Pollution of the water, pollution of the air, pollution of the food chain. They even put it in a picture for President Obama, who commissioned this study. And here is the pollution. You don't see genetics there as a cause of cancer, like most oncologists will tell their patients. That is just not true. So by removing these toxins from the body and giving the body what it needs to regenerate its cells, anybody that chooses to do chemotherapy, radiation, surgery for cancer must do a detoxification regeneration program anywhere from 2 to 8 weeks before those conventional treatments. That is a must. I consider that so necessary and so useful that I consider it malpractice if it's not done. Now, most oncologists will not agree with me, and the reason being is that we're not educated properly in medical school and the academic institutions. I've been a professor in 3 universities: Washington University in St. Louis, University of Miami, and now tell from the damage done by these toxins, which, by the way, rob the body of electrons, and that's the chemical pathway to disease. We can theoretically reverse a cancer, and that's what we have been seeing in the last 25 years. One of the best electron donors and removers of these toxins, among other antioxidants, is vitamin C. So I've been using vitamin C orally and intravenously for more than 20 years and seeing great results as part of a complete program of nutrition, stress reduction, exercise, and detoxification. So that's how we manage cancer. At the very least,